right, so hi, I'm Lazer Dave, Ottawa's laser therapy expert. I specialize in offering low intensity laser therapy to help people with quitting smoking, quitting cannabis, alcohol, stress, pain, and more. And I operate from 2 PHYSIOCARE locations. My main area is located out of Kanata, North Kanata, just off of Terry Fox on Innovation Drive, right across from the Sienna building. I've been operating out of this location for about 4 or 5 years. I also work out of the PHYSIOCARE location in Nepean on Greenbank Drive as well too. My focus there is mostly pain, but I do some addiction as there as well too, and helping people quit all types of substances. So I'm just going to cover an outline of what I'm going to discuss today. I'm going to do a disclaimer talk. I'll talk a little bit about my background in my training and my experience and my success rates. And tied in with that will be the Lazer Dave Advantage discussion. I'll also discuss, if you want, how laser therapy works, my equipment. I got some fancy laser tools right over behind me here. And we'll do like a question and answer period, see if there's any other questions that people have out there that are in attendance that I can answer. And that's probably going to wrap it up. So let's jump into the disclaimer part. Okay, so terms of use policy and disclaimer. Ottawa Laser Solutions, Lazer Dave's prep guide for laser therapy is owned and operated by 1530 910 Ontario Limited. That's my company. The information and methods presented by 1530 910 Ontario Limited. All the information that are contained in the guides, books, videos, websites, social media, podcasts, and similar are not intended to be a replacement or diagnosis or treatment of a physician or licensed healthcare provider. In addition, Health Canada and the FDA have not evaluated any of the statements, the information, or methods presented by 1530 910 Ontario Limited. Consult with a qualified health practitioner, especially if you're pregnant, nursing, taking medication, or have a serious medical condition. 1530 910 Ontario Limited does not guarantee results. Results for laser therapy may vary from person to person. All right, so we got that out of the way. Do we get some more people in attendance? Woo! We got one more. Okay, so in terms of my background, I already discussed where I'm located, but just in case anyone missed it, I work out of 2 PHYSIOCARE locations, one in North Kanata at 5035 Innovation Drive, and then I also work out of a Greenbank location in Nepean as well. I've been working with PHYSIOCARE for 4 years now. I've been specializing in laser therapy though for well over 15 years, and I've completed thousands of documented treatments. My success rates are really high, and I would attribute that to what I like to call the Lazer Dave Advantage. So what is the Lazer Dave Advantage? Well, it's a combination of my training, my experience, and my commitment to service and making myself available and having a flexible schedule for my clients, because quitting smoking, quitting cannabis, alcohol, stress, pain, it's a serious business that I'm in, and I have high standards. So with my training, the most important training that I have that would separate me from probably almost all other laser therapists, as far as I know, in the Ottawa area, is that I'm trained in the science evidence-based approach, okay? This here is a certificate of attendance for attending and doing quite well at the medical acupuncture program through McMaster University and their health sciences program. And essentially, I've studied acupuncture with needles extensively, you know, what points work best for different pain issues. I've done a lot of research on the addiction side, obviously, and application in my clinic. But make no mistake, the foundation of my approach and my practice is a science evidence-based approach, okay? Because I find that combined with my fancy laser therapy tools makes for more consistent and successful results. So, and it's not implied that I use the same formula approach for everyone. There is customization of where I treat, how much power, how much time, but I do use a rational approach, and the studies I use in my practice are they're linked on my website too, which is ottawalasersolutions.com. So in addition to my training with McMaster University, I also have a background as a regulated health professional, and that's really key because one important thing to know about laser therapy in Canada is that it is unregulated, okay, unto itself. So this basically means Health Canada has no direct regulations for, you know, professionals that claim to be laser therapy professionals are held to. So, you know, my competition and a lot of other people that promote their laser therapy experts are technicians, and, you know, there's no standards of instruction. Someone could do an hour or two long training course and call themselves a laser therapist, and you know, you have to be careful. So, you know, the short message here is it's good to pick someone that has a regulated health professional background and training, whether that's something like physiotherapy, massage therapy, chiropractic, acupuncture, you know, a nurse or similar. That will help ensure a base level of service expertise and standards when you know, when a professional is assessing people and clients for you know, for risks and side effects of that nature. You know, laser therapy is quite safe, but there are some incidences where you have to be careful with it. You know, right off the top of my head, you know, we don't want to treat anyone with an active a cancerous tumor, even though studies are showing it can shrink tumors. And we have to be careful or don't treat women when they're pregnant. And in fact, with the approach that I use and that's used in Laser Quit Smoking, acupuncture is really the underlying technique that we're using, okay? You know, we're using a device like this, which is a low intensity laser device that emits gentle laser light here. So we're not using needles, but we have to follow the precautions in acupuncture. And there are some very, very important ones, especially when it comes to, say, pregnancy. Even the medical professionals that will institute acupuncture practice into their clinical practice, they avoid certain points that the traditional Chinese medicine approach says you should not do under any circumstances when a woman is pregnant, okay? And the theory is it can stimulate, you know, the birthing process. And obviously we don't want that to happen prematurely. So, you know, there's things like that. So if you're going to a laser technician, you know, there's a chance that person really isn't that familiar with that information, okay? So, you know, that's why it's important to go to someone who's regulated or at least has a background in that, okay? So, in addition to my training, you know, what else makes me unique versus my competition? Well, the Lazer Dave advantage also includes my equipment, okay? So if we just take a little move over here. I'm gonna move the camera a bit. I've got my fancy laser tools here, okay? So as far as I know, my competition, they use one laser diode, kind of something like this, but in a different system, and they're doing each individual acupuncture point. Here's acupuncture man, okay? One at a time, okay? So, you know, you've got like important points on your hands, okay? Like 3 or 4 of them. There's important points on the head, okay? On the feet. You know, the most important points are actually on the ear, okay? Because scientific studies and clinical experience shows when we stimulate certain parts of the ear with laser, it stimulates a strong endorphin release, which helps with the withdrawal and cravings, okay? So, you know, what I'm trying to get at is that acupuncture approach is, you know, you should also have good training in that as well. And so the Lazer Dave Advantage approach, I'm using 3 different lasers here, okay? So I already outlined the laser pen. I have something called a light needle system, okay? I'm going to turn that on. In acupuncture, one of the most important points is called large intestine 4. You might be familiar with it. You may have heard that when you apply pressure between your thumb and your first finger, it can help with headaches and pain. A much more comfortable and effective way is to put laser on it. So you can see that's red laser, okay? This stuff's pretty safe to look at. The infrared, we have to have you wear glasses, so I'm not worried about that right now. But the idea is we put them on these points here, and it's painless. There's no piercing of the skin like in traditional acupuncture with needles. And I've got 12 of these, and they're working, stimulating all these points in your hands, your foot area, all at the same time, okay? Not one at a time, right? So there's that. I also use this cluster probe. Now I'm going to actually turn it on. It's near-infrared laser, so safety-wise, we have to wear glasses, okay? Because we don't want this near-infrared light. This is the only major precaution we have to take with laser therapy, is that we don't shine it in patients' eyes. So now you can see that in the camera. So interestingly enough, the human eye can barely see infrared laser, so but a digital camera can. So we know it's on, okay? So my point here is with this one is there's 5 laser diodes, 1, 2, 3, 4, 5, and I use these on the stress points for the head, okay? And so that makes 17 diodes, and then plus my laser pen, that's 18 laser diodes. So if you were to ask a traditional acupuncturist that does needles, what's true laser acupuncture? Is it doing 1 point at a time, or is it doing multiple points? And I guarantee you they'll say 9 times out of 10, it's when you do multiple points at once. You get a more synergistic effect, you get a higher success rate, and the results just tend to be better across the board. So that's a big part of the Lazer Dave advantage, okay? We talked about regulation, my training. Why don't I open it up to question and answer period? Does anyone have a question about my services that I can cover? You know, does laser therapy hurt? No. Low intensity laser therapy, also known as cold laser therapy, laser acupuncture, or photobiomodulation. It's a non-thermal application of focused light, you know, typically on acupuncture points. And this light, there's no risk of burning. It's not hot enough, you know, and the results tend to be very curative, you know, as opposed to lots of pharmaceutical, medical drug options that, you know, don't necessarily address the underlying, you know, issues, more pain control, things like that. Most people find treatment very relaxing. You know, a lot of people have told me with acupuncture needling, when I used to use needles, I don't anymore, but they found that relaxing because it can, you know, the whole science of it is to raise endorphins and dopamine and serotonin, all the happy hormones that help to reduce withdrawal and cravings from, you know, from nicotine and alcohol and other things. So, you know, it helps with that. So it doesn't hurt. Most people find it so relaxing, some of them are tempted to fall asleep. So, you know, the only potential side effects is at the end, I make sure when people are done treatment, they don't get up right away. They might be a tiny bit lightheaded. You know, usually it's a positive side effect, but they're usually a little extra tired, and that helps them sleep better, which is good for, especially for nicotine withdrawal. And the whole treatment is very, very pleasant for everyone. I've never really had anyone complain that it was uncomfortable in the least. So, all right, we have a couple questions here. So any special preparation before a treatment? That's an excellent question. Thank you, Sheila. Yeah, so when people sign up by, you know, either calling the PHYSIOCARE clinic directly, texting me, I make myself available, especially during promotions. We sign you up. There is a $50 deposit that we require to hold on to your spot, and it shows that you're committed. But I send out something called Lazer Dave's Prep Guide to Quit, okay? It's in PDF format. It's a 13-page document. You know, you don't have to read the whole thing, but the first page has the most important steps on how you can get ready and make the most of your laser therapy investment, and to, you know, push the chances up as high as possible that you're going to have not only good short-term results, but good longer-term results as well. So the keys points in my guide are, in addition to the treatment, it's very important that clients concentrate on replacing their smoking habit or alcohol habit or cannabis using habit or whatever thing they're trying to quit with a positive, healthy, stress relieving habit. So, you know, you don't want to just have this gap in your life without filling it in, okay? And, you know, there's really nothing new in terms of the recommendations of what that replacement habit could be, but typically the simpler and using your hands, the more the better. So meditation is a good one, knitting, doing crossword puzzles, Sudoku, you know, exercising is good. That also helps get your endorphins up. There's also some supplements that I suggest you take a look at, you know, check with your pharmacist or doctor, but vitamin C, there's a lot of scientific evidence to support that it helps with nicotine cravings. You won't hear your doctor talk about it, but there is one good study, and I find the laser and vitamin C together are very synergistic, and they increases my results even more. So ever since I started recommending people take vitamin C like therapeutic amounts daily, it's pushed my success rates up like 10-15%. So that's another key thing. And then outside of that, just, you know, try to make smart day-to-day decisions on limiting your risk for putting yourself in a situation where your old habit could be perpetuated. So, you know, for example, if you're trying to stop smoking, you know, don't hang out with your friends that still smoke for a couple weeks. That would be my number one. You you know, rearrange an area where you used to smoke if you need to hang out there or work there still. Make it a little bit different so the environment is different. That's another one. And then, you know, when you're trying to quit smoking too, it's a good idea not to drink alcohol for a couple weeks as well, because that pleasure center of the brain for alcohol and nicotine are very, very close together. And, you know, if you're having a couple drinks, you're likely, you know, maybe at a bar or a situation where people are potentially smoking. So why put yourself in that position in the first place? So yeah, Lazer Dave's guide covers all that, and that's included with the program fee. So why don't we just talk quickly about that, and then I'm probably going to wrap this up pretty soon. So what does your investment include? How much does it cost? Okay, so my Lazer Quit Smoking program itself is $300 plus taxes, okay? That includes 2 treatments, okay? And you use those 2 treatments within 2 weeks of each other. I highly encourage people to come back for their second treatment sooner rather than later, whereas my competition tends to not even recommend you come back for the second unless you absolutely need it. It's been my clinical experience that even if you're feeling good and you're pretty well feel confident you've been able to quit in the short term smoking with 1 laser treatment, coming back for the second one really helps with what I call the habit craving or any remaining symptoms like hunger cravings, irritability, maybe a bit of insomnia, things like that that can, you know, that could derail you, especially if your stress levels increase again in the short or medium term. So it's always a good idea to come back for that second one. You know, and a small percentage of people will require perhaps even a third booster in that first year if their stress levels pick up a lot. I usually suggest people before they go on a holiday in the first year, especially if it's like to a European country where people smoke a lot, that they get a booster. So, you know, that's recommended. So you get the 2 treatments. You get my guide. Okay, this is like 15 years of distilled expertise, you know, when combined with my laser therapy treatments, really pushes my success rates up. And then you also get the Lazer Dave advantage, okay? So I'm extremely available. If you need an emergency appointment for whatever reason, I can usually schedule same day or next day. And, you know, for the first 2 weeks, you have VIP access to me. You know, let's say your first treatment, your cravings dramatically go down for smoking and nicotine, and then maybe 3 days later, out of nowhere, they just pick right back up. Maybe your stress levels pick up. You know, you get some news that you weren't expecting. You know, they can come back. So I'll get you in sooner. Let's say you said, Dave, I want to wait 2 weeks or, you know, 10 days for my second. I'll offer you a spot sooner. We get you in as soon as possible. We get the relief you're looking for. Plus that will help compound the longer term cessation as well too, okay? So that's what your investment includes. What are the main mechanisms, a little bit of the underlying science behind laser therapy, okay? So what we know from many different studies, you know, and we can talk about this for hours, but quite frankly, I'm just going to cover 2 main mechanisms of how laser works, okay? The main one is that it promotes ATP energy production in the cells of your body. So the focused laser beams that are coming from a device like this, you have photoreceptors in each one of your cells on the mitochondria. They're kind of like the battery of your cell, and they specifically pick up very efficiently and receive energy from red laser and near infrared laser, and those are the 2 colors of light that is used on the whole for the most part in laser therapy, whether it's for pain or addiction, okay? So, so the laser puts your cells into overdrive on producing extra energy, okay? You know, those photoreceptors are called cytochrome C oxidase for you biology buffs out there. So what this equates to basically is, you know, accelerated healing, pain relief, hormone production systemically in the body, which helps with the perception of pain and stress, okay? And it allows us to stimulate acupuncture points without needles. That's a huge benefit, okay? And you know, it also, because it's just light, it's safe, it's effective, it's non-invasive, very comfortable, okay? So the ATP production is one way that the benefits are ramped up on a scientific level, okay? The other method that is involved is a process called hormesis, okay? And that's basically like a metabolic stress pathway. And the comparison is exactly comparable to an exercise program. So a little bit of stress on the body is actually healthy, and it makes the cells healthier, perform better, reduce inflammation quicker, heal faster, increases circulation. So, you know, it has an antioxidant effect as well too, to help get rid of free radicals, which can be damaging in the body. So, you know, those are two main pathways of why laser works so well. Some of the other ones, it has a very positive effect on nitric oxide, which when it accumulates in tissues, too much is not good. But when you don't have enough, that's not good either, because nitric oxide helps to dilate your blood vessels and increase circulation. So laser really promotes, you know, the positives of nitric oxide. Laser also plays a big role in DNA expression and synthesis. It can actually help with the DNA production, which is, you know, a big part of anti-aging methods these days. It also promotes growth factor, which is important for healing. Okay, anti-inflammatory cytokines for reducing inflammation related to things like arthritis. And you know, lastly, it promotes you know, angiogenesis, which is the formation of new blood vessels into tissue, and that's kind of part and parcel of the curative results that we often get with laser in terms of scar tissue for pain too. Okay, so lots of good stuff going on there. So that's all I was going to cover today. If you need more information, my website is hands down the best source of information outside of having me live here, okay? So if you go to Ottawa Laser Solutions.com, I have a ton of information on there related to my practice, what laser is, how I can help you. I have a complete FAQ section and answers to like 99% of all questions related to laser therapy, okay? It also has all my contact info from my PHYSIOCARE locations in Ottawa. So, you know, basically Ottawa's my target market. And I also have links to scientific studies. So it is important for you to go there and check that out if you want to know more. Alternatively, you can reach out to me as well if there's a question that you have that's not answered on the website. My email address is on the website, but it's dave@ottawalasersolutions.com. You can reach me there. So thank you for your time today. I look forward to doing another one. If you want, maybe leave a comment if you're viewing this later on a topic or area you would like me to cover.